Oh, Mayor, per
Folks are
usual, your text messages are the chat. You know, that's how I communicate to you doing these things.
all right. Folks are coming on in. So Mayor Stoney, if you want to get started, take it away.
Thank you, David. And good afternoon, everyone, and thank everyone for attending today's meeting of the Children, Health, and Human Services Standing Committee. And as a friendly reminder to all, this meeting is open to the press. So for those of you who don't know me, my name is Levar Stoney. I'm the mayor of the great city of Richmond, the capital of the Commonwealth of Virginia, and I'm the chair of this standing committee. Now, over the past year, this committee has been very busy organizing information sessions, webinars, and leading initiatives related to combating COVID-19. This work of this committee and the resolutions before us today have an impact in our communities. So I'm grateful to everyone who is here today to contribute to that great work. Now, today's session, we focused on the consideration of policy resolutions before this committee, and I'm also very excited that we will be joined by several special guests. But before we move any further, let's go around and give each mayor the opportunity to say a quick hello and introduce themselves. Mayors?
Hi, Mayor Stoney. This is Nan Whaley, Mayor of Dayton, President of the United States Conference of Mayors. Really excited for your leadership on this. You all have been doing lots of work, as Mayor Stoney mentioned, particularly as mayors lead on the vaccination challenges and vaccination work for getting our community safe. So really glad to be here. Wish we were in person. Wanted to say hello and excited to take part in some of the resolution work today.
Madam President, thank you for joining us this afternoon. We really appreciate you and the work you've been doing over the course of the last year as we all face the challenges of COVID-19. So thank you. Wish we were in person, obviously. Would love to have joined you. Thank you, though. Who we have next?
Good afternoon. This is Mayor Christina Mern with the City of Findlay, Ohio, Flag City, USA. Proud to serve on this committee and great to see some of my fellow mayors.
Mayor Mern, good to see you again. Hope you're doing well and surviving all the challenges that are on our plates as mayors. Good to see you. Not all at once.
Hello, this is Martha Guerrero, Mayor of West Sacramento. This is my first conference here, my first year being mayor. I'm really excited to be here with all of you. It has been a challenging, tough year and a half, and walking in, it's been really exciting though to be able to work with my community. So thank you for doing what you're doing and providing the leadership and mentorship and guidance that I need to be a good, strong mayor for my city.
Thank you, Mayor Guerrero. Thank you for attending today's meeting and welcome. Mayor Kriesman, you want to say hello?
Absolutely. Good morning, or if you're on the West Coast, or I should say good afternoon, and if you're on the West Coast, good morning. Mayor Rick Kriesman, City of St. Petersburg, Florida. Not a member of this committee, but am pleased to be attending and to a little later, after you all complete your work on the resolutions, be able to introduce to you my deputy mayor, who is also on this Zoom, Dr. Kanika Tomlin, who is going to talk about the amazing things we're doing in St. Pete on how to stay healthy. So thank you for having us.
Thank you, Mayor. Thank you so much. Now, per our custom, I would like to recognize my friend, my good friend. She already introduced herself, but I want to give her the proper and formal introduction to our committee. I want to introduce to you all our 79th President of the U.S. Conference of Mayors, Mayor Nan Whaley from the City of Dayton. Mayor Whaley, you have a few comments?
Yeah, thanks, Mayor Stoney. Just wanted to mention, as we're doing standing committee work and you all are meeting, the resolution part of the conference is really our bread and butter. It's where we stand on issues. It's where we make formal statements. And so really appreciate your willingness to take time to do this work as we continue to move the conference forward, even virtually. And I'd have to say that during this time virtually, we probably see each other or at least talk to each other more than we ever have. And we've gotten quite a bit done, from the American Rescue Plan that has put dollars directly into our cities that the conference was a key leader on, to shepherding through the bipartisan infrastructure plan through the Senate. And now we await House movement so we can have transformational infrastructure in our communities. I don't think any of this work could be done without the work of the U.S. Conference of Mayors and the leadership of all mayors coming together for collective action. And so it's a great honor to be the leader of this organization, but you cannot lead if people don't do the work that you guys are doing right now and through this process. So thank you to your staff, and thank you to you, Mayor Stoney, for being up for anything I throw your way. I'm super grateful for your friendship, but really honored to get to lead with you through these times.
Thank you so much, Mayor Whaley. And once again, thank you for your service. And I'm willing to catch anything you throw my way. Obviously, this is the biggest team project we'll ever participate in as mayors, as a country as well. And we all got to be on the same team on this one. So thank you so much for leading our team of mayors through this most extraordinary time. Thank you so much. Now I'll move on with the agenda. Our first item of business today is the consideration of resolutions. This standing committee has before it 9 resolutions for consideration today, submitted all in a timely manner. You previously received copies of them from Dalen Harris with the U.S. Conference of Mayors staff, and that will be sharing them. He'll be sharing them on the screen for you throughout our discussion. We will also share brief summaries of each resolution, and I'm happy to recognize any sponsor that has joined us today. However, I want to first share the rules for consideration of these resolutions. Under U.S. Conference of Mayors rules, mayors can add their name as a co-sponsor of any resolution through our Community U.S. Mayor portal or directly in the mobile app until noon Eastern Time on Monday, August 30th. Now, using the same website or app, mayors also have until noon on August 30th to register a no vote on a resolution that passes in the standing committee today. This option is only available to members of the standing committee in which the resolution passes. Let me repeat, this option is only available to the members of the standing committee in which the resolution passes and who are present today at today's business meeting. So while any member in good standing of the U.S. Conference of Mayors can participate in the discussions about any of the resolutions before the standing committee, once recognized by me, your chair, only mayors who are official members of this standing committee may actually vote to forward these resolutions on to the executive committee for further consideration, final consideration. Now, in addition, only mayors who are members of this standing committee can pull for discussion, offer amendments on, and make motions on vote on, or introduce new resolutions. This is certainly a mouthful, but I think it's obviously appropriate that we give everyone the rules of the road. We may also consider resolutions not previously submitted if it satisfies the following conditions. First, the resolution must be brought forward by a member who is a member of this standing committee. And second, to consider a new resolution, we must have approval of 2/3 of the committee members present and voting today. So let's move on. At this time, are there any new resolutions? I know Mayor Whaley has authored a resolution entitled the Blue Star Welcome Week, and I have agreed to co-sponsor that resolution. So that is a new resolution we'll be having. Do we have any other further resolutions at this time? Seeing none, I want to say thank you, and we will consider the new resolution last. Again, new resolutions will be considered at the end of our agenda. So for those waiting around, you will have to wait around to the end. All right, we will now move to approval of the 9 proposed resolutions in your packet. Dalen will display these resolutions on the screen. All I see is Nan now. Here we go. All right. The resolutions are on the screen. Are there any resolution sponsors joining us who would like to provide a brief summary of your resolution today?
Mayor Christina Mern is here. I'm the lead sponsor on Resolution 3 that is before you for consideration. And I just wanted to point out again, the importance of bipartisan support for vaccination. Unfortunately, we have seen such a division across the country, especially on party lines. And I think it's important as a Republican to stand up and share my support for vaccinations and encourage those who have questions about the vaccine to ask them and get information from reliable sources and understand that we each have a role to play in getting our communities and country out of this and world out of this pandemic. So happy to answer any questions. Pretty straightforward, but appreciate this committee's support.
Thank you, Mayor Meren. Are there any other resolution sponsors joining us who would like to provide a brief summary of your resolution today? Okay, as you can see, we will the titles and summaries of each of the 9 resolutions previously submitted are on the screen. I'm going to read the following ones that have been submitted, provide a little summary here. First, we have the COVID-19 Victims and Survivors Memorial Day resolution. The lead sponsor is Mayor Trey Mendez of Brownsville, Texas. Our second resolution for consideration is the honoring of healthcare workers and first responders. The lead sponsor is Mayor Greg Fisher of Louisville, Kentucky. The third resolution is supporting vaccination to protect people, families, and communities from COVID-19. As you heard from our lead sponsor, Mayor Meren of Findlay, Ohio. Next, we have the school-based mental health access for children and youth. The lead sponsor there is Mayor Bill de Blasio of New York. Fifth, supporting affordable childcare for all. It's a resolution that I have sponsored. Next, we have a resolution supporting reauthorization of the Children's Nutrition Act. Again, a resolution that I have sponsored. Our seventh resolution for consideration is creating community blue zones, well-being initiatives to combat chronic disease and comorbidities. That sponsor, Mayor Maddie Parker of Fort Worth, Texas. The eighth resolution is one in support of expanding access to opioid treatment programs. The lead sponsor is Mayor of Boston, Kim Janey. Our last resolution is the federal cannabis regulation. The lead sponsor there, Ted Wheeler of Portland, Oregon. Now, before we move on to final debate and or approval of resolutions, all mayors of the standing committee only should show your yay or nay vote by a show of hands for U.S. Conference of Mayors staff to record your vote. Now, please continue to keep your hands up so we can record your vote and attribute to the right individual. The question is now on the approval of the proposed resolutions included in the resolutions packet. At the same time, these proposed resolutions will be considered as a group, as a block. According to our rules, any member has a right to remove any of these resolutions for separate consideration, which would then be debated and put to a vote individually. Now, would any member like to have any of these resolutions considered separately and removed from the block?
Mayor. Yes, I would. I do have a couple, but I would like to request that we start with number 7, I believe, related to the blue zone communities. I'd request that this be removed. Well, do you want to have discussion when we go through consideration one by one?
Yeah, I was going to say, there's a move to consider the resolution separately. Resolution number 7 is pulled for separate consideration, and we will consider it then. Are there any others to be removed from the block?
Who's sponsoring it? Fort Worth. That's
Mr. Chairman, if there is, and I apologize again, just kind of going through the procedural side since it's a little different this time. As a committee member, if I'd like to record a no vote on these, would that be best done just through the app following approval from this committee? I know we have only a couple folks here, so I don't know if it'd be appropriate for me just to request that a couple of them be considered separately.
And Dalen, I'm gonna need you to help me out with that. I do believe as it can be recorded by app, but I want to make sure I'm following the proper procedure for this afternoon.
Mayor, you can record your no vote for any resolution as we debate them separately or in block, and also via the app. And you'll be able to do that all the way up until Monday before the executive committee meets as well.
Okay, thank
And
you.
Mayor, I'll just add real quickly that the importance, if you want to cast that no vote in the app, we will post those records to the website. So if you want kind of an actual record out there of it for people to see, that's important to do through the app.
Okay, thank you.
And I think the question was still on, are there any other resolutions that should be pulled for further debate? We
Yeah.
have 7. Number
Yeah, that is
7 pulled.
Yeah, number 7 has been pulled. The question before the committee is, are there any other resolutions to be pulled from the block for separate debate?
Christina, did you have a second one you wanted to pull?
Well, I guess I have concerns on a couple of them, and I don't want to be super difficult. If I'm the only one that's going to vote nay on something, I guess it's just kind of hard to tell who all is here. I do plan to vote no on 4, 5, 6, 7, and 9. So if we would like to pull those, I would appreciate it, and then I can just briefly comment on my concerns with those resolutions.
Mayor Miron, I think it's proper for them to be pulled and for you to be allowed an opportunity to add your voice to those resolutions, but also to record your vote, whether it's in the affirmative or not. So those numbers again, Mayor Miron?
Yes, 4, 5, 6, 7, and 9.
Okay, Mayor Miron has proposed to pull 4, 5, 6, 7, and 9 from the block for separate consideration. And those resolutions will be pulled from the block. Are there any other further resolutions to be pulled? All right, so those that remain, and I would like to have staff help me with all these numbers right here.
1, 2, 3, and 8.
Resolutions 1, 2, 3, and 8 remain in the block. And I believe there's no objection to those resolutions. If there is no objection to proposed resolutions contained in the resolutions package, the ones that remain, the numbers are again, Dalen?
1, 2, 3, and 8.
And with the exception of resolutions have been pulled for separate consideration will be approved. Is there any objection to the ones that remain in the block? Since there is no objection, resolutions 1, 2,
2, 3,
3, and
and
8
8.
are approved. Okay? Okay, I'd like to now recognize Mayor Miron on taking up these resolutions that were pulled separately now. So the first one is 3, I believe.
The first one is, I'm just going back here, sorry.
4.
Yes.
4.
Yes. So, Mr. Chairman, thank you. On resolution 4, the school-based mental health access for children and youth, certainly understand and is supportive of building up our students and recognize the key importance that mental health plays within our children and growth in all of our lives, truly. I guess my concern and my objection to this and why I will be recording a no vote is really just the specific mention of the Mental Health for Students Act of 2021. I have some operational and financial concerns with that specific legislation.
All right, now we're considering resolution number 4, which is was set aside for consideration. Mayor Murin has spoken to it. Is there any further debate?
And I'm Daryl Steinberg, Mayor of Sacramento. I would just like to understand what the issue is, what the operational concern with the legislation is, just so I'm better informed.
Mayor Murin, are you willing to answer?
Yeah, so I don't think right now, given we have very limited time to go into a deep dive on the federal legislation, but I think that overall, just the structure of the programs and kind of the way that it would be managed at the local level poses some concerns for schools. And then obviously just the overall cost to the federal government, I have some concerns with.
Okay, thank you.
All right, any further debate? All right, those in favor of resolution number 4, I believe, raise your hand in support. We'll pause so the staff can register your vote. All right.
So I have Mayor Guerrero, Mayor Stoney, and Mayor Steinberg in support. Correct?
Correct.
Correct.
Okay,
Correct.
thank you.
Correct. Now, those opposed, raise your hand in opposition.
Got it. I have 1 no. Mayor Murray, okay.
All right, we have the ayes have it, and the resolution is approved. Resolution 4 is approved. Okay, next up is resolution, I don't know what number this one is. Number 5. Resolution number 5, I will open the floor for debate.
Yes, so appreciate everybody's willingness to pull this. Again, my concern is primarily on this specificity of mandating the $15 minimum wage. Recognize that we all want wages to increase, but I believe that regions across our country differ, and I'm a proponent of kind of that free market adjustment that occurs. So really a minor thing, but have some concerns again, just on the specific federal legislation that was mentioned.
Is there any other debate? Anyone, will they be recognized? Well, I'll just speak real quick. I support the fight for 15. I believe that the current minimum wage is way too low, and these are wages that will unfortunately create a pathway to poverty, and I think we should be giving people a pathway to success. And that's why I believe that $15 an hour should be the law of the land. And that's why I support this and the lead sponsor for this resolution. With that, is there anyone else? All right, those in favor of this resolution, please raise your hand in support.
I have 3 yeses.
We have 3 yeses. Now, those not in favor of this resolution, please raise your hand.
And I have 1 no recorded.
3 yeses, 1 no. The resolution is approved. David, what number do we have next?
We are on
6.
5.
6.
6, excuse me.
Did 5. I'm here to help you count. I'm here to help you.
Thank you, Mayor.
Thank you, Madam President.
Thank you, Madam President.
All right, we're on number 6. This is the Creating Community Blue Zones Wellbeing Initiative to Combat Chronic Disease and Comorbidities. The lead sponsor is Mayor Maddie Parker from Fort Worth, Texas. I will now open the floor for debate.
So I'm happy to discuss this one. However, this is resolution 7. So Would you like me to discuss 7 and then we can go back to 6, or would we like to discuss 6?
The numbers are not on the
Let's go to
screen here.
6. Sorry about that. Let's go to 6. Sorry.
Let's go to 6. I prefer to go in order. 6 is the pull from the block, supporting reauthorization of the Child Nutrition Act, which I'm the lead sponsor of. And I will open it up for debate. Is there anyone who would like to speak to the resolution?
Yeah, thank you, Mr. Chairman. And I promise I'm not singling out your proposals. I understand where you're coming from. And again, I overall support what we're trying to achieve, just differ in how we can achieve that together. So again, just had some concerns around the federal programs that it's specifically supporting. I think that great concepts, a little poor execution on some of them. So that's really just my concern.
All right, Mayor, you do not have to apologize to me. Same map, different compass, okay? Are there any others who would like to speak to the resolution? With that, we'll be closing debate and we'll move to voting. Those in favor of the resolution, please signal by raising your hand.
I have 3 ayes.
And now those who are in opposition to the resolution, please raise your hand.
I have 1 no.
3 ayes, 1 no. The resolution is approved.
Next, we have number 7. Got it right this time.
Now we jumped the gun earlier. Now we're back on resolution number 7, creating community blue zones, well-being initiatives to combat chronic disease and comorbidities. Again, this is sponsored by Mayor Parker of Fort Worth. I'll open the floor for debate.
Thank you, Mr. Chairman. So really my concern with this is the specificity of the Blue Zone organization. Certainly believe in trying to create community well-being and health, but I think singling out a specific organization that we're telling communities to work with isn't necessarily something that we want to kind of start and promote. That's all. Thank you.
Does anyone else want to speak to the resolution? All right. Now we'll close debate and we'll move to voting. Those in favor, please raise your hand in support.
I have 2 ayes. Did I get that right? 2 ayes or yeses?
We have 2 ayes. Those in opposition to the resolution, please raise your hand to signal your vote.
I have 1 no and 1 registered no vote.
All right. I think the count was 2-1. And with that, the resolution is approved. David, do we have any other further resolutions that were pulled from the block?
Wait a second. We have a final one, 9.
Resolution number 9, the Federal Cannabis Regulation Resolution. The sponsor of this is Mayor Ted Wheeler from the city of Portland in Oregon. I'll now open the floor for debate on Resolution 9.
Yes, Mr. Chairman. So a couple of comments as I've discussed this with our local Adamus board and reviewed myself, just concerns about promoting legalization without FDA approval. Think that they're, again, great concepts. Just a couple concerns on some of the language that's included. I'm certainly not opposed to federal decriminalization and approval, but just a couple of concerns with some of the specific language.
Understood. Any others who would like to add their voices to debate? Seeing none, we will close debate. Now the question now is on the approval of resolution number 9. Those in favor, please show your support by raising your hand.
Mayor Guerrero is raising her hand, right? Because it kind of gets out of the screen sometimes. Yeah, there she is. Okay, I just wanted to tell you, Dalen, you saw her. Okay.
Yeah, I see her. I have 3 A's. Thank you for that, Mayor, because I was about to register that as a no vote. I have 3 yeses, Mayor Guerrero, Mayor Stoney, and Mayor Steinberg. Okay.
And those who are in opposition, please raise your hand to indicate your vote.
And I have 1 no.
All right, I believe those are 3 yeas and 1 no. The resolution number 9, is approved. Dalen, those are all the ones pulled from the block, correct?
Yes, sir. Now we move on to the 2/3, the new resolutions. Mhm.
Yep, the next item of business is the approval of a new resolution related to the Blue Star. Is that the one we're talking about?
Yes, sir.
Yes, the Blue Star Welcome Week, where Mayor Whaley is the lead sponsor and I have co-sponsored the resolution. Now, according to the rules, a 2/3 vote without debate is required to allow a new resolution to be considered. Those in favor of allowing this new resolution to be considered, please raise your right hand to show your support.
All right. I see unanimous consent to move forward with this resolution.
There is unanimous consent to move on with this resolution. Now the resolution will be considered. The question is now on the approval of the new resolution related to Blue Star Welcome Week. And Dalen will display a copy of the resolution, which he has already done. Mayor Whaley, would you like to say a few words about the resolution?
Thank you, Mayor Stoney. I would. Look, Blue Star Welcome Week has been a good partner with mayors across Blue Star families across the country. And when we're in person, they normally sit on our panels and discuss on how we can be helpful to families of those that are enlisted. And in Dayton, this is personally important to me in Dayton because we have Wright-Patterson Air Force Base, which is the largest single site employer in the state of Ohio, as many people have bases across the country, and making sure that family members and that are sacrificing for enlisted families get attention paid to them in our communities and feel welcome to our communities is something really important for cities that have large bases. And so this is just recognizing the week that Blue Star families are trying to promote across the country. And I'm sure that everyone will agree with this. I think it's just a great way for us to support the enlisted personnel in our communities across the country. Thanks for your consideration. And Mayor Stoney, thanks for co-sponsoring since I got this resolution in a little late. So thanks for bailing me out.
Madam President, you can count on me on any occasion. I am a supporter of this resolution as well, as Virginia is has one of the largest veteran populations in the United States of America. And my brother currently serves in the United States Air Force. So you have my support. And with that, the question is now on the approval. Or first, is there any debate on this topic? Anything else from any of the members? Seeing none. The question is now on the approval of the new resolution related to Blue Star Welcome Week. Those in favor of this resolution, please indicate your support by raising your hand.
I see that pass unanimously. 4.
There is unanimous consent for this resolution. The resolution is agreed to. I want to thank everyone for that part of our program, and we've got the resolutions out the way, the business of the committee. I want to thank everyone for participating and those who are signed on to speak later in the program as well in the agenda for allowing us to get our business out of the way. Now we'll move on to the next order of business. And on April 28th, President Biden released the American Families Plan, the AFP, a $1.8 trillion investment in child care, education, nutrition, and other supports for children and families. The plan represents the second half of the president's Build Back Better agenda and is a companion to the $2.3 trillion infrastructure framework proposed in the American Jobs Plan. which is currently making its way through Congress. In solidarity with working families, particularly working mothers who have made sacrifices to care for their families throughout the pandemic, who have unfortunately taken an unfortunate toll, a disproportionate toll of the downturn, the American Families Plan proposes significant investments in childcare and in preschool, and will greatly assist our residents all across this country and economy going forward. So today, I am pleased to introduce Mr. Elliot Hassel to discuss what these investments will mean for our children and for our working families. Now, Elliot is quite familiar to me because Elliot is a resident of the great city of Richmond, a constituent of the city of Richmond. He's currently a program officer for the education policy and research at the Robbins Foundation, one of our great foundations in the city of Richmond, and is nationally known early childhood and K-12 education policy expert and writer as well. He started his career as a fourth grade public school teacher, and throughout his career, Elliot's work has focused on providing all children the opportunity to access a quality education and thrive academically. Again, I am so pleased for him to join us today to discuss America's child care crisis and how it is critical that we fix it today and not tomorrow. With that, Elliot, I'm going to give you the floor.
Thank you, Mayor Stoney, and thank you all for having me. I want to, in just a pretty brief time, cover three main things. One, just to talk about where the sort of the state of childcare in America right now. Number two is talk about the proposals that are currently working their way through Congress and the federal government. And number three, talk a little bit about what mayors and cities can do as part of this effort. And so I think the first thing to start off when I'm talking childcare, that's my sort of shorthand for any non-parental care setting, kids birth to 5. So childcare that encompasses pre-K, and then we'll split that out a little bit in a few minutes. But as you all probably know, before the world ever heard of COVID, things were not going well in American childcare. I like to say it's matched to work for absolutely no one involved. It wasn't working for parents. It wasn't working for the providers. It wasn't working for businesses, and it wasn't working certainly for children. Huge issues in access, being able to find a childcare program. Huge issues with affordability, so not having to pay out the nose to actually have that care, and huge issues with quality of making sure that the care that children are getting was really helping them develop optimally, so that they would be ready for school and for life. And so what the COVID really did was drive sort of hit like a hammer on an already fragile system. So when we treat childcare programs in this country much more like restaurants than we do like public schools or like libraries or like fire departments. They're dependent on paying customers, depending on the parents. And so much like what happened to the restaurant industry when COVID happened, is all of those clients sort of went away. There were closures over the first couple of months, and then when they began to reopen, they had to deal with much smaller mandated group sizes, and many parents who were uncomfortable in returning their children to care. And so as a result, there were significant financial challenges. There were some federal relief funding that happened in the CARES Act that helped stabilize things, and then the American Rescue Plan Act and the December stimulus also had significant funding for childcare, which has helped sort of keep the industry from completely crumbling. We have lost a significant portion, about 10%, is some most estimates of the childcare sort of providers that we have in the country. And right now, we're facing this knock-on crisis around the workforce. So obviously, we all know there's issues in sort of the labor market generally in the United States, but childcare is being hit uniquely hard because they can't raise their wages to compensate. So childcare programs, most of them operate on incredibly thin operating margins, 1% or less. And so unlike an Amazon or a McDonald's or Walmart, they can't just get less profits and raise or charge parents more. Parents are already tapped out in order to pay their teachers more. And so the median wage for a childcare worker in the United States is about $12 an hour. With half making less. And so they're now competing. You have to think about it against the Amazons and Targets are now at a $15 starting wage. We've seen other industries raise their starting wages and also offer all of these sort of perks and benefits. Ironically, many of them offering childcare benefits as a way to entice workers to come in. So a recent survey by the National Association for the Education of Young Children found that 80% of childcare programs are facing staffing shortages right now. And for childcare programs, unlike a restaurant that might have to work sort of fewer hours or fewer operating hours, what that actually means is that these programs can serve fewer children because of the mandated ratios of child to adult ratios. If you don't have enough staff, you might have space for those children, but you literally have to have classrooms sitting empty. So we've seen this, and we know I did some work in Richmond, and this has been sort of what we're finding across the nation is that there are waiting lists that are getting very long for no other reason than the programs don't have staff. They don't have enough staff to open the classrooms to their full capacity. And so that's obviously, as you can imagine, childcare is the industry that supports all other industries that hampers economic recovery. So that's sort of what we're facing right now is this issue without and more public funding coming in, and importantly, permanent public funding coming in, because it's very hard to raise your wages off of, the temporary American Rescue Plan Act money and then have to go make them go down again in 2 years. So it's becoming very difficult for childcare to compete. So that's sort of the state of things as it is. In terms of the American Families Plan that Mayor Stoney referred to, and that's basically the framework that looks like it will be adopted in the reconciliation package that's being proposed as well, would do a few things. It would offer a $15 minimum wage, as was in that resolution for childcare workers. It would also pump a lot of money through what's known as the Child Care Development Block Grant, which is the primary way that the federal government spends childcare money down to the states, so that states would be able to really significantly expand who is eligible for childcare subsidy, and importantly, be able to raise the reimbursement rates of that subsidy. So right now, childcare programs are not getting very much money for each sort of subsidy child that they serve, and that's part of the reason they can't raise wages. Again, they're really not getting what's known as in the field as the true cost of care. So, the subsidy may reimburse at $7,000 a kid. If you actually wanted that program to be able to pay its teachers well and have for quality improvements and professional development and benefits and all the rest of it, you may need $20,000 per kid, and there's that gap there. And so the rates also need to be increased. Also, and this is where kind of the split between the 3 and the 4s and 5s comes in, the plan would offer free universal kindergarten optionally for all Americans as well. And so those are what's in that plan. One thing I'll note is that it's actually childcare in our polarized era. It draws a ton of bipartisan support. So there was a Morning Consult poll a couple months back on the American Families Plan that found that specifically the childcare and pre-K provisions were the most popular of all of the provisions in that plan, drawing about 2/3 support from all voters and drawing as sky support from Democrats, but even nearly 50% support from Republican voters as well. So this is definitely, childcare doesn't know party. It doesn't, it affects people in urban centers, it affects people in rural areas. It really, affects people in sort of very, northeastern states and Idaho. I mean, it affects everyone. So it really is one of those cross-cutting issues. So that's sort of the state of what's going on with the federal government. And then the last thing I wanted to talk about is just where the mayors can come in, where cities can come in. So local advocacy is incredibly important because for 2 reasons. One is to be able to make sure that those in the federal delegations understand what's going on the ground. They actually get that when we look at these families are not able to go back to work. Families are suffering economic precarity because of childcare. For no other reason. There's a job they want, they're qualified for it, they could get it, but childcare is the reason they can't do it. And the way that affects the children as well, and the kindergarten readiness and what goes on in the education system as well. So being able to tell those stories from the ground level up is vitally important. And then there's also this question of how cities can lead the way in really setting up the infrastructure and the innovation so that if and when this money starts flowing, to be able to be used well and responsibly. And so many cities around the country are innovating lots of different ways of supporting their childcare providers, making it so that families can more easily access services, making it so that there are innovative workforce pipelines happening and partnering with the school systems and institutions of higher education, so that there are people moving into that. So the cities really can take it, and almost every state has some kind of sort of hub or backbone organization that works in the early childhood space that's able to partner with the cities and with mayors to really move forward. I like to say localities aren't going to be able to solve the childcare crisis. The tax base does not exist for the amount of money that's required to permanently solve this, but localities can play a critical role in making sure we have an effective pluralistic system that actually meets the needs of all sorts of different families and all sorts of different children that make this country great. So, I'm really grateful for the work that you all are doing day in and day out. And I would just encourage you, to really realize that childcare undergirds everything else you're trying to do for your constituents. So I appreciate the time to talk to y'all, and thank you again.
Well, thank you so much, Elliot. And we do know that childcare is foundational to a strong economy, but also to ensure that our kids, in terms of the enrichment process that childcare can provide as well for a number of our kids, particularly those who are underserved. Thank you for your work, and thank you for being here and presenting this afternoon. I appreciate it. Now I'm very pleased to introduce our next featured speaker, Ms. Janet A. Liang. Ms. Liang currently serves as the Executive Vice President, Group President, and Chief Operating Officer, Care Delivery for Kaiser Foundation Health Plan Incorporated and Hospitals. In this role, Janet is accountable for Kaiser Permanente's California market, serving over 9.2 million members. In addition, she directs strategy and innovation in care delivery operations, including continuum of care services, Medicare, for Kaiser Permanente's more than 500 store pharmacy organization and 35 hospitals. Ms. Liang reports directly to Kaiser Permanente's Chair and Chief Executive Officer and is a member of the National Executive Team. I'm excited she's able to join us today for a timely discussion related to transforming healthcare and opportunities and lessons learned after responding or still responding to COVID-19. Janet?
Thank you, Mayor Stoney, and thank you so much to all the mayors here who are here today for allowing me just to sit in and hear this important work that you're doing around resolutions. And I applaud your focus on and your commitment to strengthening healthcare and our communities across the country, and for all of your partnership together with our local public health and our healthcare systems during this long journey of the pandemic. For those of you who don't know Kaiser Permanente that well, just quickly, we are the largest integrated care and coverage organization that's 75 years old, and we serve over 12.5 million members across the United States. We employ over 220,000 team members across the United States, and we have 28,000 physicians who work exclusively with our patients. We have a mission which includes not just caring for our patients and members for their life, and we have actually multi-generational families that are with us, but we uniquely embrace the communities that we serve. And that means to us that to achieve total health and for our members, that you must integrate social health, mental health with physical health in order to really help people achieve, be able to thrive in their lives. And so we talk a lot about our brand Thrive, which includes all of these components. So just really quickly, in the few minutes that I have, what are the lessons learned? This is a kind of I think an update as opposed to a complete retrospective on COVID, unfortunately. And as we are in our 16th month in this journey, I'm reflecting on how in the early days we were unable to contain the virus globally, and we moved to mitigation, and we could not get to suppression without either a vaccine or a treatment that would make it COVID a non-issue. And so this mitigation period that we've been in the last 14 months has had a really destructive toll on not just the lives of people directly affected by COVID, but you all know the families that that are suffering from grief, the social destruction of job loss, of kids not being able to go to school, anxiety that's been created out of fear, and the isolation for many youth and seniors has been pretty devastating. And so the social impacts of COVID are going to have a much longer tail than even the health conditions that are front and center. And so that's why I'm so pleased to see your resolution number 3 that was passed. Thank you, Mayor Murin, for supporting that and spearheading that, because vaccinations is the only way to get to suppression. simply that we have failed to get to herd immunity. Only 56% of the country is vaccinated. We are fortunate to be a country that does not have a limitation in access to vaccines, whereas other countries don't have vaccines. You know, we are a country that has a vaccine, and yet we have not vaccinated completely our population to reach a suppression level. You know, globally, because of the inability to get to suppression, we have our new Delta variant, which there have been over 20 variants. Many of them just come and go, but Delta is thrives because it's more infectious. And until we get to suppression, we're going to have more variants, right? So if we as a country, if we as a world want to suppress COVID, we all must be vaccinated. It's not enough to only have 56%. And until then, here's the tough news. We live in this world of mitigation. We live with masks, social distancing, fear, business disruption. That continues on until we feel that we have suppressed COVID. And that is why the vaccines are so critical and really important that business and healthcare and public health, our public officials all are unified in a voice around vaccine mandates. We have come out strongly at Kaiser Permanente on mandates. Our CEO, Greg Adams, is on the Business Roundtable, the White House Business Roundtable with other employers, and we've been a leading voice around mandates. Not all employers are willing to mandate, and there's different variations of that, certainly, but we feel if we think about the bigger picture for our country and a resumption of normalcy in our lives, vaccinations is the only way to get to suppression. So that was my advocacy. So 5 quick learnings as we think about COVID: equity, digital divide, public health investments, the deferred care implications for our health system, and mental health. Those are the big 5 things that I just want to speak a minute on each. For equity and disparity, much like our previous speaker, you know, there is inequity in healthcare and racism that is just what we see in structural inequities in societal institutions, and that includes healthcare. So wherever you saw cracks in systems before, they were amplified and made more transparent through COVID. We know that through published data that, you know, African American and people of Hispanic descent have died at a rate of 2.8 times that of white populations in our country, right? And we also, when we look at vaccination rates, you can look at Hispanic, Black, particularly Native American, you'll see that the vaccination rates trails white and Asian populations by a good 10-15%, right? The same as with Medicaid for poverty. So those who are being the most greatly afflicted by COVID right now are our communities of color. Now, the trust in public health was at a baseline low for community of colors for generational reasons why, both coming out of the healthcare system, and so the most trusted voices are usually your direct physician offices, organizations like Kaiser who have been with members through generations, or your local FQHCs who played a really important role in reaching out. And this particular campaign in this time, we also found it super effective to work with other kinds of social support agencies, case management organizations, homeless shelters, faith-based organizations. They all were a conduit to reach out to try to, you know, improve the disparities during this time. But, you know, we have to do more. And that's where each of these, there's always, we can do more. And we need to see more money from the infrastructure bills. We need to see more investment in diversity in all the different roles, from contact tracers to caregivers, physicians, and we need to amplify our voice all together with leadership in our communities that vaccines are safe, right? And that we need you to get your vaccine shot. So we provided a $10 million grant to the Public Health Institute in California, and this is just an example with the explicit goal of hiring people from communities of color and in vulnerable communities to become contact tracers. 70% of the people I hired succeeded in that goal, and they were extremely effective because they're part of the community, they spoke the language, and they were able to, because we know that people will be vaccinated. To get people to flip, it's either somebody that's like them or someone that they trust, like their physician. So more work to do here, but now, even with the Delta variant, we were really, really worried about, and now that the third booster campaign has started, we're really worried about the primary vaccine, the 40% of the country that's still not vaccinated is heavily in people living in poverty and people of color. So they will get left behind as we move to the third booster campaign. Second is digital divide. So good news on healthcare. Healthcare had to quickly provide virtual services, and so where we were not very consumer friendly before, we became consumer friendly. And you know what? The healthcare consumer will never be the same. People like televideo, they like not having to go in, they like texting. And so that kind of convenience is here to stay in healthcare, which I think is a good thing. It also helps with reach, also for people who can't drive in, and the cost of commuting in to see your doctor. So I think there's some plus side on the digital side. However, the digital ease in which we did vaccination appointments and talking to your doctor, again, creates a divide in our society. And this is not only one of people of color, but also for seniors. So more than 1 in 3 U.S. households headed by somebody over 65 years old does not have a desktop or laptop, and more than half of them don't have a smartphone device. And 30% of Hispanic and Black children do not have a computer at home, which we saw with education, compared to 14% of white children. So access to computers, even when they have them, Americans don't know how to use them properly. So big message here is that we need federal, state, local leaders to fund access to technology that people, I don't know, maybe we need for Medicaid, you have to provide smartphones to all the Medicaid patients because it's become a health tool now, right? And the way that you connect to services. So they need the tools, people need literacy training, and we need internet broadband coverage in rural communities. Right, there is not enough broadband coverage, and even enough in some of our urban communities where there hasn't been an investment in the infrastructure, and the internet connection wasn't strong enough for video and education. Third was mental health. Mental health has the need has grown tremendously on a workforce that is already of great shortage in our country. And there's 2 different things happening. One is emotional distress that comes from grief of losing someone in your family due to COVID, stress of homeschooling your children, parents in isolation, the overall disruption in people's lives. That's distress. And that is different from people who are have a clinical mental health diagnosis. And in that population, we saw increased severity. People got worse, right? So people with mental illness got worse, and then a lot of people who weren't living in distress are now living in distress and need some help. So according to the CDC, 40% of adults are reporting that they're struggling with either mental health or substance abuse, and that's another issue that we've seen is a very significant increase in substance abuse in our country. So what do we do? This is a long topic that Mayor Steinberg could probably give a dissertation on, and I appreciate his partnership in California around mental health, but there's no one silver bullet. But what you can do as mayors is be knowledgeable about what the comprehensive solutions are and how do you influence and knit together in your city, in your counties, in your state, a broader solution that increases the number of providers, that encourages the development of health educators with mental health certification for the emotional coaching, because not everyone needs a psychologist, right, or a psychiatrist when you're dealing with grief. Right? You need someone to talk to, but it's not necessarily a clinician. And also the role that we want to place in community organizations, including schools. We have school nurses, we have speech therapists, because we understood the connection of health and children, right, early on, early intervention. and we need some type of sort of early intervention for emotional support, resilience with children in schools. So that is missing. Deferred care, all of your healthcare systems are strained, stressed, people are tired, and the concern on this one is that if you set aside COVID patients, there was a year of people not getting their prevention screening, where people with cardiac conditions or chronic illnesses like diabetes that were not coming in for their care. They were getting their prescriptions online, but they weren't necessarily getting their labs done and managing their chronic condition. And so we have seen chronic conditions worsen, people showing up into the ED at worse states. And also, because we're not doing the screening, there is this underlying issue of people with cancer, for example, who I'll give you a real example. So according to studies, every 500 patients we screen for mammography, there's always one cancer death that's prevented, right? So at Kaiser Permanente, we do 1 million mammographies a year. We're only going to do half of that this year because we were unable to do mammographies. And so we know there's probably 500 people with cancer who are undiagnosed right now. And they don't have symptoms, so they don't know to come in. But by the time we get to them, it's going to be a stage 2 or stage 3 cancer, which is much more invasive to treat, or it could be fatal, right? So that's an example of this hidden implication of COVID. With these busy EDs now, if you arrive with a stroke to one of these busy EDs, every minute counts. People can't get to you as fast as we used to, right? So there is a tremendous toll on the healthcare system for everyone, not just COVID patients. And I will also say that healthcare workers are pretty tired. We talk a lot about moral injury, and I saw another resolution there supporting our healthcare workers, and I thank you for that and recognizing them. But right now, and they risked their lives, they came to work in the early days of the pandemic. But now there's a growing frustration because 85% of the people in the hospital are unvaccinated, right, of COVID patients in ICUs, people dying in their 30s, in their 40s, in their 50s. They're not, the elderly that we saw in the early stages. It is unnecessary, it's frustrating to see it, and they're continuing to risk their lives to come and take care of the people who chose not to be vaccinated when we as an advanced country have the vaccine. Very, very frustrating. And so nurses who have young children at home who can't be vaccinated say, why should I risk my life to bring home, with the risk of bringing home to my child who's not vaccinated, or an immunocompromised grandparent? Why aren't they getting vaccinated? So we need your help to get the message out that we must mandate vaccines. So last is public infrastructure. My last minute is that it was really clear that local, state, federal levels who were unprepared for the pandemic. We got better as it went on, but it was pretty clunky, pretty chaotic across everywhere. And I really believe that's due to years and years and years of inadequate funding and investment in leadership in our public health infrastructure. And so this is where, coming out of this pandemic, if we're going to be good stewards of our country and of our people, that we would reinvest in public health infrastructure. It was one of the reasons why we were so slow to respond well to COVID. The other challenge, I think, was that, I don't know how to get around this, but the nation's leaders were not speaking with one voice, whether it's governors, mayors, White House, CDC, and that caused a lot of confusion for people and mistrust, and people turned to social media for advice, and there's a lot of misinformation, and that's what we're combating today around, there wasn't one leadership voice, so people had to go to other sources. And so I hope that we can all speak with one voice, and that's why this mandate vaccine, if we can all speak with one voice, will crowd out all the kind of social media noise.
Janet, what we've done in Richmond, we've put in a vaccine mandate and follow for our employees, and it has worked out. 85% of our employees have complied. They have until October 1st to be fully vaccinated. About 70% of our employees are fully vaccinated. So we do believe it works. It helps with getting a lot of city workers are Black and brown people and who live in the city of Richmond. So we think this is the way, if we can get every other one in the capital city, major employers involved, we believe that we can get our vaccination rate up and also ensure that our kids can stay in school all year round. We have to move on right now because we have someone else as well. Janet, thank you so much for your contributions during this most critical time in our country's history as we all mayors fight the challenge of this disease, COVID-19. Thank you so much.
Thank you. All right. Bye-bye.
Bye-bye. All right, our final speaker today is a mayor. I'm pleased to introduce my good friend and colleague, Mayor Rick Kriesman of St. Petersburg, Florida. The mayor was sworn in as the 53rd mayor of St. Pete, Florida in 2014, ushering a new era for the Sunshine City, and has served as a leader in the city and our conference in so many ways, showcasing innovation at every turn. Today, he's joined by Dr. Kanika Tomlin, the city's first African-American female deputy mayor and administrator of one of Florida's largest cities. Dr. Tomlin is a thought leader, a policymaker, a community ambassador, and health advocate. And together with the mayor, they work to strategically advance St. Pete towards its goals. Again, I'm very happy for them to join us today. They're showcasing an exciting initiative in St. Petersburg that is improving health outcomes, reducing health inequities, and implementing policies and programs that give all of our residents, all of their residents, an opportunity to reach and enjoy optimal health. Mayor Kriesman, Deputy Mayor Tomlin, we only have a short time, but you all have the floor.
Thank you, my friend and Mr. Chairman, Mayor Stoney, and to your staff, also to all our fellow mayors. So I'm going to be quick as my Deputy Mayor and City Administrator, Dr. Kanika Tomlin, is, I know, standing by, excited to share with you one of our big success stories here in St. Petersburg, which is our Healthy St. Pete initiative. And I was only about a year and a half into my first term when we launched this ambitious endeavor, and it certainly has proved fortuitous considering the major public health crisis that has come our way in 2020 and we're still dealing with. We are proud of the fact that St. Petersburg, Florida, located in the most densely populated county in Florida, consistently had one of the lowest COVID positivity rates throughout 2020. And without getting too political, quite frankly, our governor didn't have a hand in the success. The cities have done it. And there are many reasons why we were so well prepared for the shock of COVID. We were more resilient, and I strongly believe that creating a culture of health has had a lot to do with it. Now, prior to asking her to serve as our city's deputy mayor and city administrator, Dr. Tomlin worked in the healthcare world, serving as a regional vice president of external affairs for Bayfront Health Network and director of strategy for Health Management Associates 23 Hospital Florida Group. And since joining my team, with her healthcare background, she has led this effort for our city, built a team, and her team has built a community here in St. Petersburg dedicated to this important cause. So, mayors, it is my pleasure to introduce to you St. Petersburg's Deputy Mayor, Dr. Kanika Tomlin.
Thank you, Mayor Kriesman, so much, and Mayor Stoney for that gracious introduction, and to all the mayors who are on today's call. Thank you for your continued commitment to our nation's health, our children, and its overall well-being. I'm very happy to be with you here today. I'll share my screen, and I am mindful of your time, but so grateful for this opportunity to talk to you about one of my personal and professional passions and one of our city's highest priorities, and that's creating a culture of health. And I want to tell you why it's one of the most important ways our city cares for our people. In our city, this work is known as Healthy St. Pete. Healthy St. Pete is a community engagement and empowerment initiative that's designed to enable, accelerate, and promote a culture of health in our community. It makes the healthy choice the easy choice and helps our community live, shop, eat, and play healthier. There are countless reasons why people choose to live, work, and play in our city, and access to health and a robust balance of all the determinants of that health needs to be a permanent inclusion right at the top of that list. Here's a quick video that I'd like to show you, which is how we tell the story of Healthy St. Pete in our city. and invite our community to be a part of the creation of our culture of health.
To take advantage of where we live, to spend time with friends, to learn a new skill, to take the opportunity to move and to keep moving. To choose the fresh option and to make our health a priority. Healthy St. Pete makes the healthy choice the easy choice by partnering with local restaurants to create healthy options, advocating for a more bikeable and walkable city, providing free exercise zones and local groups, implementing policies that promote a culture of health. Many more health and wellness options for residents. The choice is yours. Join us in becoming a healthier St. Pete.
Now, when it comes to our culture of health, our healthy St. Pete is our what, but the social determinants of our health is our why. You know all about the social determinants of health, so I won't get too into that, but we're doing pretty well here. All of our critical indicators for growth, development, and the future are pointing in the right direction. We've decreased poverty by more than 30%. Our crime is down. We have affordable housing, sustainability, and infrastructure plans that are making a generational difference, building stronger neighborhoods, great schools. But even with all of that excellence, this next map tells you why we focus so much on health. This is a map of St. Pete's average life expectancies. And the 3-mile span that separates the darkest disparity-filled blue block from the affluent, lighter-filled one just north of it, there's about a 16-year difference in life expectancy. Interestingly, but not surprisingly, it's also a very close graphic representation of the areas of most acute need as it relates to healthcare disparities. And you don't need a deep demographic dive to know that our healthcare disparities closely track our income levels, which for too long have mirrored our educational outcomes, our quality of housing. It goes on and on. The truth is, you could layer almost any one of those determinants over this map and get the same outcome. So Mayor Kriesman and I and our entire team across all of our administrations, we set out in committed partnership to promote and create a culture of health that changes that map and our community's truth. So that we move much closer to one homogeneous color across our entire city, so that anybody, regardless of the corner of the community from which they come, have the same expectations and odds for a happy, healthy, safe life. Health in all policies is our how. It's the systematic integration of our culture of health into our governance. It's the defining component of our work to make health a priority in St. Pete. And this commitment is reflected in our philosophies, our policies, and our practices. It's a formally adopted methodology that is codified by the mayor's executive order, funded by our community's largest private foundation, includes the partnership of 3 neighboring governments, and is guided by our local Department of Health. We literally integrate health considerations and planning into all of our work at the point of inception and steward those considerations through every point until completion. It manifests through policies, programs, projects, and plans. And this discipline has served our community very well through good times, and the resulting culture of health has sustained St. Pete through the defining disruption of COVID mitigation and management in this very trying time. Our HIAP approach focuses on changing the systems of decision-making rather than changing single decisions one at a time, and this is where our culture shift comes in. It incorporates health considerations across all of our sectors and policy areas. And it's important to note that our health in all policies approach is not meant to force sectors to prioritize health above all other metrics such as cost or environment, but it encourages the use of a health lens and elevates health in consideration of every decision. It helps bring light to how a decision impacts health and allows us ways to find additional ways to promote health. It's a collaborative approach that's been championed throughout our community. Beyond rhetoric, it's a very real and guiding principle for all of our work across all of our systems and processes, and touches everything from our comprehensive plan to our budget development and is everything has to answer the question of what is the impact on this initiative as it relates to our community's health. The final P in our formula to prioritize health in our community is partnerships. We couldn't do it without others in our community. We've convened long-term stakeholders from every sector who share our goals for creating that culture of health, and we're careful not to create any programs alone. Everything we do accelerates, amplifies, and advances goals that have been mutually agreed upon by our community, creates a deep level of ownership, trust, and propulsion that makes these important initiatives across our 4 platforms of eating, living, shopping, and playing healthier very real realities. So our plans, our programs, our projects and policies, there are pathways to the prioritization and implementation of sustaining self-perpetuating practices that are building a culture of health that we expect to last much longer than our time of shared service in our city. And people are taking note in our region and even beyond. St. Pete is being regarded as a standard bearer and innovator in areas of public health. It's been helpful in great times, and it's certainly been helpful when it's mattered most. It's a marathon, not a sprint. And as it relates to our race to the top of the nation's healthiest communities, St. Pete's work is just getting started. Thanks so much for your time and attention today. It's been a great honor to share with you, and we would love to talk with any of you more about how we've implemented health in our policies and Healthy St. Pete in our community. Thank you, mayors.
Thank you, Deputy Mayor Tomlin. And Mayor Kriesman, anything to say to wrap us up?
No, I know you're running over. Appreciate the opportunity to present this to you all. And as the Deputy Mayor said, if anybody has any questions, we are eager to share what we're doing here in St. Pete with you.
Dalen has shared some information, a link in the chat for everyone. Please check it out. Not only should you not just visit St. Pete, but also look at the program and look at their culture of health as well, and how you can copy it in your fellow city as well. With that, thank everyone for joining us today. Thank all the mayors, the committee members, and additional mayors who joined, and also our presenters as well. Thank you for joining us today. We are adjourned.